It has been 3 years since COVID-19 hit the United States and swept across our nation. We now have vaccines to protect individuals, a messenger RNA vaccine, which there has been a great deal of hesitancy for patients to receive vaccine. Part of this has to do with the lack of understanding of the way messenger RNA vaccines work. They've been using messenger RNA technology for at least the past 20 years. COVID is the first time we've introduced it in a means to vaccinate our population. So of course patients were scared. What is this? How does this work? Can I trust this? There's a multitude of studies showing the efficacy in the United States of Moderna and Pfizer. There are many other vaccines across the world, AstraZeneca, and it has shown a great deal of efficacy providing protection against COVID-19. It doesn't guarantee you won't get COVID. However, it will guarantee that you have a much abbreviated, less symptomatic course of COVID if you were to contract the virus, even if you're healthy. And you say, if I get COVID, I'm not going to get that sick. I'll be fine. I'll get past it. When you're sick, you have the potential to spread that virus to your 75-year-old mother who had a stroke and suffers from multiple sclerosis or diabetes, heart disease. COVID infection in a 75-year-old with multiple comorbidities can be lethal. If not lethal, severely morbid, prolonged hospitalization, weeks in an ICU on a medical floor. Mom might never come home again. Mom might end up in the nursing home. You vaccinating yourself potentially helps mom not get sick from COVID. Herd immunity is the concept that as every individual in the population develops immunity against a virus, it will no longer spread. You can wait until you get the virus, or we can induce a herd immunity with vaccination. You will not develop the symptoms of the COVID infection. You will have immunity within 14 days, very similar to as if you contracted the virus without the sequelae, without the consequences of becoming ill. We use vaccines to create herd immunity in a much faster, effective, safe fashion compared to waiting for the entire population to become exposed and potentially develop severe long-term health conditions, if not death, from an unnecessary COVID infection. As we interviewed patients, we realized there's an abundance of misinformation that they had access to. Some had political ideas that this was some conspiracy. Other individuals thought the vaccine would actually kill them. So we take time. We take time to educate our patients. This is a safe vaccine. It will reduce your likelihood of contracting COVID. And if you were to contract COVID after vaccinated, lessen your illness. Maybe a runny nose, maybe a slight cough for a few days, but you're not going to end up in a hospital in the ICU or potentially die from a COVID infection. Every patient I encounter, I express to them, vaccines save lives. Every vaccine we offer you is a chance to protect yourself against a potentially lethal virus. COVID-19 is no different than measles, mumps, rubella, chickenpox, meningitis, every other vaccine we have available to protect your children, your loved ones, yourself. We strongly encourage vaccination.